Hi, my name is Dr. Ross Hauser. Welcome to the Florida office in Fort Myers, Florida. Pretty regularly, I get people who've been diagnosed with chronic Lyme disease, and they're on all these different protocols. Recently, I had a patient who actually spent 7 months at a facility here in Florida to try to get over the symptoms of chronic Lyme's. I also have clients who've tried Lyme's protocols and their symptoms just aren't getting better. This was one particular person. A lot of people don't realize from 1994 till 2005, I ran a charity clinic in a very small town called Thebes, Illinois, which was on the Kentucky, Missouri, Illinois border. And that area is a Lyme disease belt. It's a Lyme disease belt. The Shawnee National Forest is there, and there is just a lot of people, in that area by the forest over there, they get Lyme disease, and there was various Lyme clinics there. And so I go down there, just being a Christian, all the care that we did, all the prolotherapy care, we gave away for free because it was a very poor area. And what ended up happening was a lot of these people who had been on protocols, antibiotics for years, they're on these various complicated Lyme's protocols. I started to see them because they were getting word that there was this charity clinic, there was this new treatment called Prolotherapy, and people's fatigue, their brain fog, their digestive problems, their swallowing difficulties, their ringing in their ears, their tinnitus, their dizziness, their facial pain, it was going away. Well, eventually some of the Lyme's doctors that were down there then called me up, and I actually trained some of them basically in prolotherapy. So if you have Lyme's disease or been diagnosed with that or been on a chronic Lyme's program, or it didn't help, or you're on some kind of a maintenance thing but you still have brain fog, I'm just going to illustrate one case. So let's run this particular person, he had terrible brain fog. So we're going to see, we'll stop it when he's all the way down. Stop it when he's all the way down. Okay, it's a little bit hard to see, but you could see C2, C3. There's this incredible amount of instability, and there's actually instability at C3, C4. And this is just one case that I'm illustrating. Izzy and I looked up, and this is a patient from a while ago. On the second visit, when the person came, they got one treatment of prolotherapy of this area, and the mother, because a lot of the mothers or the parents of these people, like they literally have to care for them or help them financially because the Lyme's treatment is so expensive and everything. So he was like a totally different person after one visit, because we started treating the cervical instability. I got him in a collar so the circulation to his brain was good, the blood supply and the drainage was good. And the patient didn't realize that when you have cervical instability, it can affect the blood supply to the brain, and it can affect the cerebral spinal fluid flow, and it can also affect the drainage out of the brain. So once this got normalized, and in him it was very quickly, it was unbelievable, the transformation with one visit. So anybody who has the brain fog, has dizziness, vertigo, all the different things that we think of with chronic Lyme disease, you really should get an assessment with a digital motion x-ray, and it may be that your symptoms are actually from cervical instability and not chronic Lyme, and that you could actually get resolution of the symptoms by a simple, effective procedure called prolotherapy.